Okay, so today I'm going to be talking about pelvic floor engagement and abdominal approximation work. This is really important work if you're pre or postnatal or you suffer from any kind of back discomfort. A lot of times our abdominals are not necessarily working appropriately, so we're just going to have a quick kind of look at that. So the pelvic floor for women is made through the vaginal canal that kind of floats up and in. And then for men, it's actually the reverse structure. So it's the testicles and the penis. And so we're going to think about that lifting sensation. So for men, it's going to feel like jumping into cold water. There's a gentle lifting from underneath, but for women, it's a little bit more complex. For women, it's kind of a closing through the abdominal structure that goes into the pelvic floor, so the vaginal canal closes, and then it kind of feels like it's lifting upwards because it's kind of like a hammock that comes inwards and then has a fold. So it's kind of lifting all the internal organs. This is really important, especially when you are postnatal or prenatal, because the weight of your organs plus the weight of the baby changes the amount of pressure on the pelvic floor. So we're just going to quickly talk about that. So you're going to put 2 fingers above the pubic symphysis, which is the pubic bone, and you're going to kind of place the other hand here across the ribs. You're going to inhale through your nose, and you're going to exhale forcefully through your mouth like you're blowing on a candle. You want to make sure, of course, that you're not collapsed, but that you're sitting with a nice, long, upright spine, creating that natural curvature through the spine, which is kind of that S curve. So, tailbone, sacrum, lumbar, oppositional curve, thoracic, upper back, internal curve, and then cervical, again, the opposite direction, kind of ending in the ears. And you want to kind of think about that being nice and long. So again, fingers, and you're going to inhale through your nose, exhale through your mouth. Now, you can also make an H, and that will automatically also engage it. You can also practice this by, if you're peeing, go ahead and hold your urine for like a few seconds, count to 10, let it go. Don't do this the first pee of the day, you just want to get that out. It's been in you long enough. So again, nice big inhale through your nose, feeling the ribs expand outwards. So we're not necessarily doing a diaphragmatic breath, we're doing a lung expansion, moving into what is Pilates, is our 3-dimensional breath. And if you don't know that, I will link you a video or you can see it below. You're going to take a nice big inhale through your nose. And again, exhale, narrowing at the waist, and you'll feel a tightening across the pelvic floor. And you want to feel both the vaginal canal close and almost feel like it's lifting up and in. Like your belly button is getting a little hug and your organs are getting a little hug from the hammock of the pelvic floor. And again, inhaling through your nose, you can release. And again, exhale, pull the pelvic floor tight and feel the ribs narrowing for 5, 4, 3, 2, 1, and then fully release. Now we're going to keep that same practice. You can feel free to do more of those if you'd like. You can always pause this and do more, or we can move on. I'm going to talk a little bit about abdominal approximation. So you have a muscle called the transverse abdominis, and it kind of starts up here by our floating ribs and actually wraps all the way across and attaches at our sternum. It also runs all the way down our spine, kind of to our hips, and comes all the way across over the hips, down and towards the pubic bone. And it basically wraps your whole spine like a girdle. This muscle on average is only about as thick as a piece of paper. It is a very difficult muscle to feel because it does lay pretty much flush to your organs. So if you had a lot of tactile feedback with it, you'd actually kind of feel your organs. So it's one reason it's a little bit harder to find. So especially if you're pregnant or postnatal, or you have any sort of diastasis, which is when you start to get a little bit of herniation along the diastasis recti. Quite often starts from the navel and will go up or down, or sometimes it goes all the way down or all the way up. Totally fine, totally normal. Of course, if it stays rather large and you're quite postnatal, it's something you can address with the doctor and also address by surgery. But we are going to kind of address just sort of working on reteaching those abdominals to close and wrap inwards. So we're going to put the heel of the hand kind of on either side, kind of by the ribs. So, and I don't want to have my thumbs at the back, I want my thumbs at the front. I'm spreading out my fingers nice and wide. I'm going to start with a nice big inhale through my nose. Feel again, not keeping the shoulders down, nice big inhale through your nose. And I'm going to slightly press in with the heel of the hands. I'll turn slightly sideways so you can see this. And you're going to exhale, spread out your fingers and actually slightly push your hands inwards and rounding, like you're trying to close that abdominal structure as you exhale. And then again, inhale. You can feel that breath open. And again, exhale. So there's that Kegel, and then you're gonna press in, approximating or closing and wrapping that abdominal structure closed. And let's do it for an exhale this time for 6. Take a nice big inhale. Kegel, so you're gonna feel that closing, and you're gonna exhale for 6, 4, 3, keep on exhaling, 2, 1, and nice big inhale to release. Take a second. And again, placing the hands around, you're gonna take an inhale, feeling that breath kind of expand the body. Start with that Kegel, and again, exhale, press slightly in and forward, closing that abdominal structure. Again, exhaling for 6, 5, 4, 3, Kegeling, 2, feeling those sit bones slightly narrow, 1, and again, nice big inhale. If you're having a little trouble finding your sit bones, you can always draw your flesh out from underneath, and again, ground down through the floor. I'll do that 2 more times for 6. Again, kind of wrapping around towards the back, approximating or closing the abdominal wall as you exhale for 6, 5, 4. Finding that Kegel, 3. Watch your shoulder tension, 2, and 1, and 1 more time. Nice big inhale. Woo, here we go. And again, exhale, approximate the abs. Find that Kegel, find that closure of the structure of the abdominal wall for 5 more, 4, 3, 2, 1, and release. And we're just gonna roll those shoulders. Oh, no tension. So you can use this practice kind of at any point when you're feeling a little bit of stress in the low back. It's a good one to kind of help reconnect the abdominal wall. And when we use that abdominal wall to kind of reclose, because it's really important that the transverse does close and does learn to come inwards to contract, so that we don't overuse our obliques or overuse our ilium and our psoas, because that, or our QLs, which kind of are between the floating rib and the hip, because when that all starts to get really tight, it starts to kind of pull the back more into an extended position. So you're sitting and standing more here, which is going to continue to tighten and continue to weaken the front of the abdominal wall, which then is just going to load L5S1, which is that kind of low tailbone, low back connection, and you're at much greater risk for herniation in the disc. So that's one reason why it's really important that we kind of focus on that deep, low abdominal connection, the pelvic floor and the transverse. Even though sometimes they're hard to feel, they're extremely important for spine health. So yeah, if you have any questions, you can always shoot me a message. And thank you so much for taking the time to watch this and to practice this. And if you have any questions, you can always feel free to reach out to me at any point. If you're having a wonderful day, and let me know